Just to introduce ourselves, first of all, we know a lot of you already. We're so grateful that you've come along today. My name's Julia and I'm a doctor by background, but I now run Every Doctor along with other doctors, all of whom work within the NHS. We have felt compelled to run a campaign this winter, which actually began back in November, because we could see what was going to happen in the NHS and the danger that patients and staff were going to be faced with. We're certainly not alone in speaking up about this. Lots of healthcare leaders are doing the same, and we know that there's lots of efforts going on. But we thought it'd be helpful to bring frontline doctors in contact with the politicians who we know are working hard to try and lobby the government into making some changes to keep people safer. Now, back in November, when we were thinking about this campaign, we tried to think of some short-term policy solutions which would improve things. As we all know, there are enormous long-term problems facing the NHS, and we know that the solutions we're going to be presenting to you today are not going to fix everything, but they would be relatively easy for the government to implement if they wanted to, and they're doable in the short term, and they would make things safer because they would work by strengthening the NHS workforce. So I'm just going to reiterate this one more time. So guys, if you've got questions, please pop them in the chat box and we'll answer them at the end. And please keep your microphone on mute for when you're not talking, just so we don't get any background noise. All right, fantastic. Hannah, could you pop us onto the first slide then? Thank you. Okay, so just a brief agenda. So I'm going to talk you through a couple of the stats affecting the NHS at the moment and the policy solutions that we've come up with, which we think could help. We're then going to move swiftly on to talk about a few case studies that we've heard from the NHS frontline, which are written case studies. And then I'm going to hand over to two of our team members who work in the NHS. Kath Fielder is a GP and Maria Korech is a hospital consultant. Quite frankly, I think their testimony today is going to be more powerful than anything I can tell you. We have constructed a briefing document with all of the statistics we'll be mentioning today and a lot more information. We'll be sending that out by the end of this week. It's also freely available to anyone else who would like it. If you email us on campaigns@everydoctor.org.uk, we offer it to all Every Doctor supporters. So for this meeting, we know how pressed you are for time. I suppose what we want to convey during this meeting is the urgency of this situation. Sometimes when we start campaigns, that urgency isn't as significant as it currently is. I'm sure you guys have been looking at the headlines in the papers about what's happening in the NHS. Every single day that the government fails to take action, more people are dying. We can't say it in more stark terms than that. And so the main takeaway from this meeting, if we could choose one, would be that you guys engage with us to do everything you can to hold the government to account. And we appreciate that a lot of you are already doing so. Hannah, could you move on to the next slide, please? Okay, so as we all know, which is why we're all here, the situation in the NHS has never been worse. It's actually really horrifying to see the things that are occurring now. I was looking at some old articles last night of winter crises in previous years and the types of messaging that was coming out in the media 5, 6, 7 years ago about all of this. When you look at the examples of what was happening then and what was declared to be a crisis, and what is happening now and declared to be a crisis, there is an absolute disparity. Things are really terrifying. We have been told ourselves by a very high profile journalist that in order to get these sort of NHS stories into the papers these days, things have to be worse in a stepwise way than they were the previous year, because news desks don't want to be reporting on the same things. But the reality is that the situation has been getting worse and worse and worse and worse, hasn't been properly tackled, and now it's a humanitarian crisis. And as I've said, we've got 5 short-term policies which we're going to explain in a minute. Hannah, can I have the next slide, please? Great, so I'm just going to take you through a couple of statistics quickly in each of the 4 nations within the UK, because as you know, the NHS is actually 4 separate healthcare systems. In the NHS in England, there are now 7.2 million on waiting lists of people waiting for NHS care. That is the longest it has ever been on record. Since the pandemic, this number has actually been going up month on month on month. It has had quite a lot of reporting, and we know it's caused a lot of concern for politicians, and yet the government have somehow managed to ignore this figure going up. It's the one of the biggest things I would say that has led to this current crisis, because there are simply so many people requiring healthcare now, and they're deteriorating as that healthcare is not available to them. We've got a situation, as you probably already know, where our A&E departments, the ambulance service, GPs, hospitals and social care are all under enormous strain, and it's causing a lot of patients to have to wait or not even receive the treatment they need. There's a figure here in November, 37,837 patients waited for over 12 hours in an A&E to be admitted into a hospital bed. And that's a significant increase since last year, as you can see, a nearly 355% increase since November 2021. Could you go to the next slide, please, Hannah? Thank you. Okay, and Scotland, we've just included this graph because I don't think you even really need to pay too much attention to the figures on it. Just look at the lines, it's terrifying. This is a graph that shows the waiting times within emergency departments in Scotland in the Christmas week. And as you can see, there's 3 different measurements on here. There's the number of patients waiting over 4 hours, that's the dark blue line. The purple line is over 8 hours, and the line at the bottom, the pale blue line, is over 12 hours. So as you can see, all of them are going up exponentially now. It's really terrifying to see that happening. In fact, sorry, exponentially is probably the wrong word, but going up significantly. Could you go on to the next slide, please, Hannah? And in Wales, there are also significant problems. The way that Wales judges their ambulance calls is by a system where a red call is a life-threatening emergency requiring an ambulance, and only 48% of those ambulances arrived within 8 minutes recently. The target for there is 65% arrive within 8 minutes. During the Christmas week, there's a figure that's come out showing that ambulance staff in total waited an equivalent of 310 plus days just sitting outside hospitals waiting to hand over sick patients to A&E departments. And the reason that is happening is because ambulance services are picking up sick patients, delivering them to hospital. They would hope that that handover to A&E care would happen smoothly and efficiently. Everyone would hope that, but the the A&E departments are so busy that they're struggling to receive those patients in a timely fashion. And that obviously has knock-on effects because the ambulance service then can't go out and pick up the next patient. And could we have the next slide, please, Hannah? And in Northern Ireland, we have just included one snapshot here. They have a website that shows a snapshot regularly of how many patients are waiting in an A&E department at any one time. So the snapshot from the 10th of January, I think it was done at 12 p.m, showed that at that point there were 659 patients waiting in emergency departments, and of those 659 people, 356 of them have been waiting for over 12 hours. So if you look at that in terms of the proportion of patients waiting, that is a significant number of people waiting far too long to receive emergency treatment. Okay, Hannah, do you want to move on to the next slide? Okay, fab. So in trying to make sense of this, we have been trying to establish where the pressure points are and where the solutions could be found. And ourselves and lots of other healthcare leaders have been bringing up that the staffing crisis is one of the most key things that could be tackled by the government. In England alone, we're missing almost 10% of the NHS workforce at the moment. That's significant because it means that the staff remaining in the service are having to work more and more under more pressure because they don't have enough colleagues, frankly. Dr. Adrian Boyle, who's the president of the Royal College of Emergency Medicine, has been putting out some fantastic statistics about all of this and statements in the press. He has said that the service is being stretched by a staff retention crisis. And we would agree with that. Staff have been under this unbelievable pressure for years now, and they're really not being supported enough within their workplaces by the government in various ways. The NHS has to be seen as a group of people who are delivering care, and you need to take care of those people as well as recruiting more people. Could you pop onto the next slide, please, Hannah? And so when we're thinking about the short-term solutions which could improve things, the NHS workforce is at the centre of it all, because if we strengthen the workforce, we'll make things safer for patients. So we've put together this 5-point plan. We have been talking about this for 2 months now, and almost 12,000 people have now written to their MP asking them to lobby for these 5 things. And I'm sure that lots of you have probably been receiving lots of those emails. Thank you so much. I've seen a lot of your responses to your constituents. I know that lots of MPs are extremely concerned about the situation. Unfortunately, we have not seen movement from the government in a significant manner on any of these 5 points. They did make some changes to the pension scheme, but they're not significant enough to have brought back people who are cutting down their hours into the service from what we're hearing from our network. But let me just run through what these 5 things are. So first of all, as we all know, everyone is experiencing an energy crisis and a cost of living crisis at the moment. The government have put together a temporary plan to absorb the costs of these energy increases in price, but that comes to an end within the next few months, and they don't have a long-term plan to absorb those costs. It's really important that that happens because NHS budgets are already incredibly squeezed at the moment, and hospitals and GP surgeries and other healthcare facilities need to have support at this time to absorb those costs. So that's quite a simple thing. It's simply a budgetary decision. Number 2, NHS staff have been woefully unsupported throughout the pandemic and since the pandemic. We did a lot of campaigning about providing more mental health support for NHS staff after the pandemic, because a lot of our members were really traumatised, and many people have been diagnosed with depression, PTSD and other mental health problems. And the government did put together a package of mental health support in early 2021. But what we're hearing from staff is that it's not enough. There's waiting lists. The amount of mental health support they're receiving is not comprehensive. It's not easy to access in all places. That needs to be tackled. If you don't look after the mental health of the staff, the care that they're able to deliver to patients is going to deteriorate, and we're going to lose more and more staff. I talk to a lot of doctors every day. I'm connected both socially and through my work with a lot of doctors. And I know doctors now who are moving abroad, who are starting up flower farms, who are becoming dog walkers instead of working as doctors. I mean, people are really reevaluating their lives because of the stress they've been under, and if we don't support them, we're just going to lose more and more staff. It came out recently that we were losing 400 NHS staff per week in England because of primarily stress that was being absorbed. The third one is about pay. Essentially, if you think about the NHS workforce, we need as many staff working at the moment as we possibly can. Because they're under enormous pressure when they're at work, lots of people don't want to take on extra hours at the moment because it's incredibly stressful and they want to prioritise their personal lives. There's a scheme that the government have put together where there are things called locum caps, and essentially it puts a cap on the hourly rate which staff can earn out of when they're doing extra hours. And some of those rates are simply too low. We hear about NHS workplaces which cannot find the staff to work those hours because they're just not paying enough. There are some exemptions to these locum caps already, and there are also some locum agencies who we feel are taking advantage of a situation where high rates are being paid to some members of staff. But the main problem we have at the moment is that the staff working, for example, within a hospital who might offer to do an extra shift or 2 a week to, relieve pressures, those are the staff who aren't being paid well to do those extra hours. And if we could uplift those rates, we would see people taking on those shifts. I think that would make a really big difference at the moment. Number 4, the Home Office has had problems with its administrative backlog for a long time now, and it's something that hasn't really had enough focus in the media. Throughout COVID, it got a bit more attention from some MPs who were concerned about healthcare workers who were in the UK on visas. At the moment, we are recruiting quite a lot of healthcare staff from other countries to come to the NHS and bring their expertise and skills to help bolster our NHS workforce. And yet what is happening in many cases is that staff are being given jobs, they're arriving in the UK, and they then need to have a few pieces of paperwork processed before they can start those jobs. We're hearing about doctors who are having to wait up to 6 months to have that paperwork processed. not only is that enormously stressful on an individual level for these people who've come to the UK to offer their help at a time of crisis, it also makes absolutely no sense in systemic terms. The NHS needs a lot of staff, and so the Home Office really needs to tackle this backlog and start, processing those applications much more quickly. And finally, we need to make some changes to the NHS pension tax regulations. They're pushing some senior doctors out of the workforce. Now, I'm conscious of time, and I'm conscious that I want to move on to the frontline NHS doctors so that they can explain to you the problems in their areas. But just to put it in a nutshell, we within our network are talking to lots of senior doctors who are being punitively treated within this pension scheme at the moment. What happens is that a pension pot is allowed to grow by a certain amount every year. People don't have control over that, apart from changing the number of hours they work in the NHS in order to minimise their pension contributions and minimise the amount that pension pot grows in the future. And so we're hearing about doctors who are receiving huge tax bills from previous years because they have stepped up and worked lots of extra hours to support the service and support their colleagues and patients. We're now hearing about those doctors cutting their hours and refusing to work extra hours because they can't face receiving another enormous tax bill in the post. It's ludicrous that the government have set up a system like this where our most experienced clinicians are being pushed out of the workforce. I know personally of a number of consultants who are cutting their hours significantly because of this, and it needs to be addressed urgently. Jeremy Hunt knows all about this. He actually was talking about it himself several months ago and yet hasn't taken action, and so that's really important. Okay, Hannah, could you move on, please? Great, okay. So we've just put together here a few written case studies of people within our network who are sending a lot of information in about what is happening where they're working. I'm just going to read these 3 examples out to you because I think they're very stark and powerful. This one, the first one, comes from a consultant psychiatrist in the southwest of England. So she says our crisis team, so a crisis team is sort of like an emergency team within psychiatry, often have no qualified nurses on shift. They're completely overwhelmed with sheer clinical need and often cannot deliver safe care. There are not enough psychiatric beds, so the threshold for admission is incredibly high. This means we're left managing very unwell patients in the community with not enough community staff to do so safely or effectively. We're hearing about the mental health crisis in lots of different ways, actually. It's one of the key areas within this crisis, which is really terrifying. And this is one of the reasons we need that workforce to be bolstered. There simply are not enough staff right now. So the second case study, I hear from lots of doctors at the moment who are considering resigning from their posts because they don't feel able to continue. I've had another message this is from one of our members who said, I'm very close to resigning again, but I've just had 2 GP partners resign, so the practice will fold if another goes. And actually we're starting to hear about quite a few GP surgeries who are either considering closing their practices and handing back their contracts to the government, or have already done so. And that has an enormous impact in local areas. I'm sure some of you are hearing from constituents where this is going on. It's devastating, really, for the GPs who've made a commitment to work within a community. And finally, this is an example that's come from a doctor in the south of England. So they've said, we have what is essentially a skeleton workforce dealing with unprecedented demand, forced to work in a broken system that's been breaking them for years now. Waiting times in paediatrics A&Es are reaching 12 hours, and the impossible conditions have led to patient deaths, as is the case up and down this country. So this is the sort of thing that we're now hearing about daily. As doctors, we take it really seriously about not coming across as sensationalist or overstating facts, because it's really important. And a few years ago, we would have had to be really careful talking about patient safety in terms of deaths occurring. It's really horrible to recognise that the situation has now deteriorated to the extent that I'm regularly now receiving these types of messages. Could you go on to the next slide, please, Hannah? Thank you. Okay, so I'm going to hand over now. Dr. Kath Fielder is a GP in the North East of England, and she'd like to share her views about what's going on at the moment. Thanks, guys.
Thanks, Julia. So my name's Dr. Kath Fielder. I've been a doctor for 14 years and a GP for 10 years. Over that time, I've watched NHS staff numbers, service provision, funding and social care shrink to the dangerous levels that we're seeing now. It's not just in A&E that we're seeing hundreds of avoidable deaths each week due to the unsafe delays in care. My patients are suffering untenable delays in hospital appointments, scans and diagnoses that I am confident have led to otherwise avoidable disability and death. Examples like, instead of waiting 2 weeks for a colonoscopy for suspected cancer, it might now be 8 weeks, with the wait to see the surgeon being weeks again. And this could be time for cancer to spread and no longer be curable. These are real people with families and with loved ones. Patients wait months for hospital appointments and procedures, often being unable to work and developing mental health problems in the process. I've got patients who have become suicidal whilst awaiting joint replacement surgery because we're just not able to keep on top of their pain. I write to their consultants who reply telling me that literally everybody on their waiting list is in the same situation. I don't send patients to hospital unless absolutely necessary, and I don't ring 999, but I ask patients to get a lift to hospital as the wait is too long. The last time I actually called 999 was in November last year, and it took 10 minutes before the ambulance servant even answered the telephone. What if there was a child choking in front of you? It's absolutely terrifying. Colleagues give similar stories of being unable to admit very unwell patients to hospital due to increasingly high thresholds, and sometimes actually being criticised by inundated paramedics for calling an ambulance. Just yesterday, a colleague working in out of hours called ambulances for 3 patients who they felt had sepsis. The ambulance service called those patients back, triaged them and told them to see their GP the next day. These are patients who a GP has already decided needs to be in hospital straight away. A colleague also recently had a patient who was a young mother die of an asthma attack because of the delay in the ambulance. We've had patients complete suicide after we were unable to get a review from the overwhelmed crisis team, and this is not a one-off. Mental health services are absolutely not fit for purpose. People may wait for months only to get telephone treatment or even just an online course, which absolutely is not enough to help them recover. Again, they're often not able to work during this wait, which has social and financial implications for them. Community services cannot meet demand, and mental health inpatient care is almost impossible to access due to lack of staff and beds. So patients needing to be in hospital for severe conditions, such as an acute psychotic episode, might have to travel the entire length of the country to get a bed, and that is if they can get a bed. The volume of workload in GP is now ridiculous and dangerous. Last week, during a full clinic, I was on the phone to a paramedic, at the same time receiving a screen message about an unwell patient in the local nursing home, and also fielding an urgent query from one of our receptionists who came into my room. It is impossible to make a safe decision in that kind of environment, and every decision we make has to be safe. Colleagues are taking patients to A&E in their own cars. We give patients money for taxis to get to hospital, and we're giving out our personal mobile numbers to patients in case of difficulty over the weekend because we know how difficult it will be for them to access care. The NHS runs on the goodwill and commitment of its staff. Any service run in the private sector in this way would have folded years ago, as nobody would have put up with these conditions. We are putting everything we can into keeping things going, but we simply cannot function within this level of underfunding and demoralisation. The state of the NHS now is a humanitarian crisis, and I don't know what it will take for this to be acknowledged. In 2017, during winter pressures, it was declared a humanitarian crisis, with nowhere near the hundreds of avoidable deaths that we are seeing now. I don't know how many people have to die before this is declared. We are all willing to keep working to keep the NHS going, but we cannot do it without acknowledgement of this crisis from you and your colleagues in government, and an authentic commitment to engaging with its resolution. It is not naive to believe that the NHS can work. It did work, and it was exceptional. It is truly in your hands now, because we can't do any more. Thanks.
I think you're on mute, Julia.
Sorry, thank you, Kath, that was really powerful. Maria, would you be able to speak now about your experiences up in Scotland as a hospital consultant?
Yes, thank you everybody for coming. I think this continues to be really important. I think Kath's testimony reflects what everybody's seeing across the UK, and I think that's why we can talk confidently about a humanitarian crisis. It is widespread. It happens everywhere. This is not a political game. We have to step up, because the UK residents are not getting the care that they deserve, the care that they need, and they are dying. It's as simple as that. They are really suffering. I work in a general medical department in a hospital. I usually see patients when they come to the ward to receive acute care. I no longer see them up in the ward because they're all waiting in A&E for more than 24 hours. What happens then? It's not a safe environment. People die because they don't receive their usual medications, because they fall off a trolley because they are trying to reach a toilet that's simply not there, because their delirium gets so much where it's distressing. People are already suffering. I see that every day, and people have begun to die, and we are already seeing that too. I cannot tell you right now of any specific case, but it is happening. And the Royal College of Physicians and the numerous organizations, medical organizations, are all together in this. I'm sure that you are sick of seeing doctors' testimonies in the newspapers, but think about it. We are usually quite conservative people. We don't like to put ourselves out. We fear what our employers will say if we talk to the press. We don't do this often. I've been here for 21 years. It's the first year that I step up into the limelight, and I talk to journalists and I talk to politicians, and I say what I have to say, because as Kath says, we've already done all we can. The ball is in the politicians' court. I am one of the physicians that has to work less in order to preserve some sort of sanity in her tax bill. I'm already facing probably around £13,000 of tax this year for my pension. That's the calculation that I've been given, all for the extra hours that I had to work because there is not enough staff. Okay, so I've had to reduce my hours. So the people that are reducing their hours are not senior doctors that are about to retire in 3 years' time, are people like me. I am 46. I've been a consultant for 7 years. I already have to work less hours, because if I work all the hours that I can work, I would have a tax bill that's completely unattainable. I wouldn't be able to pay it. So I don't think the government has done enough for us. The people that are off sick with mental health problems in the NHS, it's a very high percentage of people, and numerous days of work are being lost. We have a good sick pay system, but I think eventually it will have to go, because it won't be workable. We have to do something to stop the drain of people that go off sick because they've had enough, because you cannot work and having the knowledge that you have and having the spirit that carries you to do the work that you do, see that people are getting worse and that people are not receiving the care that they deserve. Is demoralizing to the extreme. It's what's making people sick. What's making people sick has nothing to do with pay or pensions. It's the fact that we cannot provide the care that we were trained to provide. I chuckle when I hear people saying like, oh, the excellent care that the NHS, we don't give excellent care by the slightest. I came here in 2001. I was envied by my colleagues back in Spain and back in Belgium. Envied because I was providing very high quality care, because I was learning from the best, because I was receiving excellent training. The training of my juniors is terrible now, because we're so run down and so completely overwhelmed with what's happening around us that we're making people work that above their training, because we don't have enough staff. And each day that we do this, it's a gamble for us, for our career. If we make a mistake, if we don't do something right, we know we won't get the support from anyone to tell the GMC what's happened. Nobody's taking into account that this is what we say it is, a humanitarian crisis. We are careful with words. We are trying to be very careful with words. This is it. This is a humanitarian crisis. We don't have an NHS that can guarantee basic care anymore, not in any of the nations of the UK. And we cannot do anymore. These 5 measures that we're proposing are a start. Please push for them, because we have to do something very, very quickly to support the staff and to ensure that the people that come through the door get care that they require, and they are not dying in a corner or suffering terribly just because there's nothing else for us to do, nothing else we can do.
Thank you, Maria. Really powerful. When we first set up Every Doctor about 4 years ago, it was my biggest fear that we were going to be in a situation like this. It's absolutely terrible for everybody involved. We're running this campaign. We've so far had 15 MPs pledge to work with us on this issue and to call for these 5 measures. But horribly, only a few of those MPs have even requested a meeting with us, and some people have delayed that meeting for weeks and weeks. When doctors approach an emergency like this, we are trained to respond to things as if it's a life and death situation. And the team was thinking and talking and writing about this last night. How do we approach this in the same way we would approach a patient who is in an emergency situation? There's a set way you manage things minute to minute to keep a person as safe as they can be. And we're trying to apply that same logic to the NHS now. The government, in its plans that they're putting out, are not approaching this situation in the same way. They are making plans which in the medium to long term, if they were properly funded, might make a difference if they also increase the workforce. They are not approaching this as if it is the humanitarian crisis that it is. If you look at the numbers of hundreds of people dying unnecessarily per week, and you compared that with, for example, a plane crash, of how many people would die in a plane crash, it's as if several planes are crashing every single week and everybody on board those planes is dying. And somehow this situation is not being treated as such. We are going to be stepping up our campaign. The one thing we do have on our side really is that we're in contact with about 400,000 members of the public who are deeply concerned about all of this. We're really, really grateful for you guys coming to this meeting today, but what we need now is action. We will work with you however you need that to be done. We are happy to write speeches, write Prime Minister's questions, write letters with you, turn up to meetings, put forward spokespeople, write opinion pieces in the papers. Whatever it is you need, we will step up and deliver that, and we will ensure that our doctor network help out with that as well, because they're incredibly dedicated to this campaign. But we need you to work with us, because as doctors and as a campaign organisation, our power here is limited beyond simply the numbers of people who are willing to speak about it and support the campaign. It's really, as Kath and Maria has said, it's up to politicians now. It's in your hands to change this, please. Okay, right. I'm going to go to the chat box and see if there's any questions in here yet for the team. Okay, there's nothing in there at the moment. Does anybody want to ask anything? Please feel free to unmute yourselves and direct questions to me, and then I'll hand them over to whoever I think is the most appropriate to answer the question.
Hi, Julia, can I ask a question? So you're on mute, I can't hear you, but I'm hoping that's a yes. Give me a thumbs
I'm so
up.
sorry, Daisy. I'm having a tech problem here. Thank you so much. Yes, of course, speak, please.
Sorry, but thank you. I mean, you may or may not be aware, I've certainly been calling on the government to call for a national critical incident. I'm very acutely aware that some hospitals have declared a critical incident. The vast majority of ambulance trusts have. What I'm hearing from ambulance bosses is that the 4 levels of emergency, the REAP levels 1 to 4, basically don't mean anything anymore. That's basically what they're telling me. So the idea that they're all on level 4 just doesn't mean anything, because they're kind of off the chart in terms of where they might be at now. In practical terms, from where some of you are on the front line, is that something that you think would actually help? It's not a political point. Genuinely want to know, would that actually help free up more resources, or do you actually feel as though most hospitals, even if they haven't declared critical incidents, are actually starting to cancel all the regular training and meetings and everything else that's freeing up capacity? Or do you think that there is more that could be done if it was escalated to that?
Maria, do you want to take this question on?
Yeah. Yeah, I know that in Scotland, critical incident was called into trusts, well, the equivalent of trust, NHS boards, I think last week, and we received, text messages like, if you can't come to work, please come. Does it make a difference? It doesn't make a difference in that this is not an incident. This is what we're going to face every single day until somebody sorts something out. This is not, the flu pandemic has been a little bit worse, that's true, but it's not just that. It's not an incident, it's not a train crash or something like that. So people are reluctant to treat it like that. I think it's weaponizing something that is meant to be there for an incident, like a train crash, like terrible shooting, something like that. I think we have to call this a humanitarian crisis. I'm sorry, it's what it is.
Yeah, and I guess
if we're seeing things cancelled, we're seeing training cancelled, tracing get cancelled all the time, management meetings get cancelled all the time. All those things have already gone by the window. Usual activity, I don't know from one week to the next whether I'm going to be allowed to have my normal clinic. I have 2 clinics a week, and I don't know if I'm going to be allowed to have them from week to week, because I don't know what's around the corner. So that's already happening.
Kath, do you want to answer as well?
Yes, please. Thanks for your question, Daisy. In the recent weeks, we've been getting lots of emails basically telling us to stop doing our job. We've been getting emails in general practice saying, don't admit patients to hospital, as if we would ever admit them if we didn't think they needed to go into hospital, not to do urgent work. But the problem is, things that are maybe reviewed as routine will be patients who've been waiting for years, and problems that may have been seen as routine 2 years ago are now absolutely critical, with massive impacts on patients' daily functioning and mental health. I think the only thing that the things that sort of level of critical incident declaration is just telling us to do less, whereas we're already at such a point of scarcity now in terms of staffing and available services. All they're basically saying is, could you be a bit more dangerous? Could you take some more risks? And it's just, it's not helping anything. It's just making things worse, and it's actually leading to more patients presenting in crisis at A&E.
The situation, just to add to what Kath and Maria have said, which I think all of that is obviously incredibly relevant. You're absolutely right, Daisy. The systems that we have in place in terms of category 1 to 4 ambulances, or how hospitals process things when stuff gets busy, it relies on the system working basically. And for within situations where the pressure goes up a bit, these things kick in to kind of change the way the process works to ensure that everybody's safe. But at the moment, the pressure on the system is at all areas of the system, and it's so intense that that declaring a critical incident and trying to put in place those, emergency protocols actually isn't really freeing things up and getting things moving again, because there's nowhere for the pressure to go. We were talking about this in our team last night because we were wondering, is there an area of the service that isn't having enough attention? Is there stuff that could be cut back in order to put the resource in different areas? What we're hearing from the doctors in our network, who, I talk to all the time, are saying, they're reiterating what Kath has said. Basically, a lot of the stuff that's classed as routine really isn't routine anymore, because people have waited so long for their treatment. So a lot of the clinics where people would normally be seeing checkups, normal standard type stuff, a lot of those doctors and other healthcare staff are seeing real emergencies now. And so you can't really shut those clinics down and know that you're going to keep people safe in doing so. the reason that we want to declare this as a humanitarian crisis and put the government under pressure to declare it as a critical incident is a different conversation, because if they were to treat it in this way, it would force them into taking more action in the ways that we have requested with these five points, because we don't think they're treating this with enough urgency. The healthcare staff are, and in the ambulance service they are, in all the healthcare facilities they are, but it's up to the government now to do something differently, we think. Great, thank you. Does anybody else have a question they'd like to ask? Let me just check the chat box in case there's anything in there. Oh, yes, I imagine everybody's going to be MPs. We will be as well. I'd like to thank everybody now as well who might be going to the debate that's happening later. I know that a lot of Labour MPs are going to be going to that. Please get in touch with us. So I suppose our takeaway is that we're stepping up this campaign. We're describing it as a humanitarian crisis. If you can work with us in any way, please get in touch with us. We would be more than happy to support you in any way. We really appreciate you attending this meeting today. Thank you very much, and we'll be in touch with further information when we run another meeting similar to this. But I really hope that before that time, things get moving, the government finally takes responsibility for what is going on, because so many people are being failed. Thank you very much, guys. We're going to end the meeting now. Okay, bye.